I'm Dr. Carrie Lam. This is Dr. Michael Lam. We're going to be talking about the do's and the don'ts of IBS. So what is IBS?
Well, IBS stands for Irritable Bowel Syndrome, and this is actually it's a relatively new condition that over the last 40 or 50 years has come into the forefront. And it's what we call a basket diagnosis in medical terms. When we don't really know what's going on, we know something is wrong, so we give it a name based on the symptoms. So irritable bowel, as the name implies, is a bowel that if you kind of look at it from a microscopic perspective, you do endoscopy, you do x-ray, there's nothing wrong. The physiology is intact. But yet the body is just not very happy in the gut level. Sometimes bloating, sometimes diarrhea, sometimes constipation. And some people may be more diarrhea prominent, some people may be more constipation prominent. It can be wax and wane, it can go flip-flop from one to another. It's just, if you look from far away, it's not like you have an acute diarrhea, like if you are going to a foreign country and travel and you got something poisonous. It's just you have an irritable, unhappy bowel, and this concept is what is developed from there. Right. Of course, we still don't know what is really going on, although there's a lot of research,
And you can even, nowadays, they split it into IBS-C for constipation, IBS-D for diarrhea, and IBS-M. It's a mixed picture if you have both. And it usually goes on, like you said, it's not acute. It's going to be at least like 3 months of you having these symptoms before you can actually have IBS.
And some people, it goes away. And sometimes it can drag on for years and decades. But what is clear is that IBS is actually a symptom and really not a disease on its own. So therefore, it behooves us to really understand the root level of what is really going on physiologically and biochemically, so we can successfully help people with this problem.
So one thing that there's a few things you can do that we're going to be talking about. So eating well is obviously very important. You want to figure out what types of food you are sensitive to. What is irritating you to make you have constipation or make you have loose stools. And so what are generally good foods to eat are good foods like avocados, even fish, coconut, and chicken, turkey, kelp, and seaweed. So those are better foods that are on the better side for IBS. And even fibrous fruits and vegetables, those are very good for you to have regular bowel movements if you're having constipation. So you have to see, are you on the constipation side, are you on the diarrhea side, and fix your diet based on your symptoms.
Now, I wish it's so simple, and for many people, especially if you are normal, you're relatively healthy, what Dr. Carrie is giving you are some very good tips. But if you are an adrenal fatigue sufferer, and if you have already many other symptoms such as fatigue, anxiety, sleeplessness, hypoglycemic types symptoms going on, then adding the IBS symptoms into your already a basket of unhappiness can actually throw you over the edge. So it's very important that we titrate and understand the person very closely, because believe it or not, they are all interconnected. So for example, if your adrenals is not happy, it can back up to the liver. If the liver is not functioning well, then the hepatic circulation can be affected because the body backs up. Right. And it can cause the gastric mucosa in turn to be leaky. So all these things has a boomerang effect, okay? Mm-hmm. Okay, but now most of us, there's so much research going on IBS, but for practicality speaking, I think we just try to offer you some tips to kind of help you along the way while we, deal with it. Now, the key
things that you want to do can be like sleeping and resting, taking some time off for yourself, decreasing your stress, because the mind has been really connected to your gut. Like we said, the gut can be a second brain. So if your mind happens to be stressed, your gut might also be stressed.
Now, one thing that's very important is people don't think about too much is, well, how does the adrenals tie into the IBS type picture? Is that when your body is inflamed or irritable, then the body automatically puts out cortisol as a compensatory mechanism to stabilize. Now, the adrenal is responsible for this cortisol compensatory mechanism. So if your adrenal function is not optimized, then your ability to control is going to go down. That's why for the same person may have IBS today, may not have it tomorrow, as they recover from adrenal fatigue. For many people, their IBS get better. You don't have to do anything. On the contrary, if you try to use medication or force the body to come when it's not coming, or to regulate it on a day-to-day basis as when it's a moving target, you can actually cause much more damage along the way.
So that's why helping with the stress in turns helps with your adrenals, in turns helps with your gut. Things you don't want to do is be around negative people, which can cause more stress to you. And you want to not eat any inflammatory foods. So any junk food, processed food, any pesticides in the non-organic vegetables. And you want to keep an eye on foods that you are going to be sensitive to, that your body can't handle.
Yeah, the 4 key things: corn, wheat, dairy,
Gluten.
and gluten are very excitatory and inflammatory foods. So just to get started, you should basically try to reduce those and see whether that helps or not. And for many people, that alone can be sufficient.
So that's our do's and don'ts for IBS. We hope that you learned a lot today, as we're here to empower you to take control of your health.